Welcome back to Plastic Surgery Untold, greatest podcast in the world as voted by us. We're still so fortunate to have Nikki, CEO and founder of Brella, the sweat patch, which has absolutely been one of the exciting products that we've brought onto APS. We were fortunate enough to be one of the pilot spots for Brella this past year, but now opening up to the entire country in 2024. So I think other practices will get to enjoy the success, and a lot of patients throughout the country will be able to enjoy this. But let's really jump into, who's a good candidate, what are the uses for this, and who might this benefit? So, Nikki, give us a little background in case people missed the first episode on Brella. Shame on you if you did, but if there's still an opportunity to hear it, and then we'll talk to Jenna and Joe about the patients they specifically have treated.
Terrific. Well, thank you again for having me to talk about Brella. It's one of my very favorite subjects. It's a sweat control patch that delivers 3 to 4 months of sweat control in a very simple, straightforward procedure in the clinician's office. And really, this patch is designed to reduce sweating for those people who are just bothered by their sweating. This affects everyone sweats, and about 1/3 of people are bothered by their sweating because it's just a little too much. It bothers them when they're wearing a white shirt. They have to wear clinical strength antiperspirant. They have to reapply that antiperspirant on a regular basis throughout the day. They have to take multiple showers. So if any of these things resonate with you, that's probably a sign that Brella is something that you might want to ask your clinician about.
Jenna, talk to us a little bit. What are the most common things in our office that when patients come to you and thinking about this? And some of it is you just kind of hearing their overall concern, and they may not say that, I feel like I'm sweating too much, but it's actually the kind of secondary fallout from the sweating too much that really bothers them.
Exactly. I think when I'm speaking with patients, a lot of times it's just kind of become something that they feel hasn't been a solution to, or a reasonable solution to. And so we all sweat, to your point, but we all have triggers that make us sweat excessively, which can have fallout such as staining our white shirts, not being able to wear silk blouses, having to wear clinical strength antiperspirant, carrying baby wipes to wipe down your underarms. I mean, all these different effects and those behaviors that we're trying to change so you don't have to worry about it. But this is something that's great for figuring out what is your trigger. For example, it's something that you may not even realize is a quote unquote problem, but I intentionally got married in January outside in Texas because I was like, I'm gonna be wearing my white dress and I don't want to be worried about sweat. I don't want to be worried about those different things. So there are different events that can cause all of us to sweat excessively. And if you just don't want to have to worry about the extra little portion, this is a great treatment because it affects everybody.
And once you start sweating, then you think about it. Now you get even more nervous. It gets worse and worse and worse. And so it's actually kind of a common effect for me in terms of that. And so I think that's been super interesting. And most of the time it's, we've talked about it out kind of offline. It's one of these things like, could you ask me like, oh, do you worry about a perspiring sweat? I would have said no, but like once you kind of do the treatment, and now that I don't have any, I don't even know that I could go back to sweating and doing those things because it's made stuff so much easier. I'm not worried about taking off my jacket. I'm pretty animated. Anybody that knows me, and I'm all over the place. And now I don't have to worry about big old pit stains or yellow stains on my 1 or 2 white shirts after my weight loss journey. So, it's interesting. It's one of those things that comes to your life and you're like, how do I live without this?
Right.
PHO, some thoughts. You see a lot of patients in San Antonio, a little bit different group as you see a lot of the weight loss patients, but some of the same concerns.
Yeah. I mean, mostly weight loss patients using Brella, which I love. With our weight loss revolution, it's about changing lifestyles. And so part of changing a lifestyle is getting into the gym. And that's where I see Brella be so successful for me as a provider, but also for my patients, is because when you haven't exercised for a long time, you're on this weight loss journey, you walk into the gym and you immediately feel all eyes turn to you, right? And so with Brella, it's one less thing. You don't have to be self-conscious about that sweating. You can go in there, you can create this new lifestyle. And so it's been amazing. It helps my patients get back on their feet and to be confident in themselves again.
Brella fits so well because I would say some of the things that we've seen in our weight loss revolution is people just feeling confident about themselves. Me personally, I was a high school and then actually a college athlete, and somehow life just got away, got busy doing some things and just put on a little bit of weight, then a little bit more, then a little bit more. And part of the whole weight loss revolution has been, gaining some of my confidence. I'm excited about shopping, excited about, being in front of the camera again. But another added to that is Brella, and I feel like it does some of the exact same things. So now that you're feeling feeling super confident, super great, you want to continue that. And that's one of the things that you have empowered people to be able to do.
That's really our goal. Our goal is to empower people to be able to wear what they want to wear, not worry about presenting in public, not worry about, do I have to carry an extra t-shirt or shirt in my car just in case? It's taking one extra piece of worry out of your day-to-day life. Because for goodness sakes, we have enough to worry about every single day. Do we really want to worry about whether or not our white shirt is going to be stained or our silk blouse? One of I have a closet full of silk blouses that I used to kind of avoid when I went to meetings because I was a little bit worried about what would happen if I was in front of a bunch of people or in a crowded room. Not only would I ruin the shirt and have high dry cleaning bills, but I would feel self-conscious. So being able to, pick out any shirt that I want to wear, no matter what color, no matter what fabric, is a key benefit for me as a Brella user.
Or slowing down our TSA experience, because I traveled with Jenna recently to a conference and there was 18, different bottles of deodorant, perspiration stuff in her bag that
not
helped
anymore.
us up. They examined every single one in security. So thank you, Jenna, for making our TSA experience and body cavity searches a memorable one. Thank you.
Well, and the other thing that you both touched on, which I think is really, really important, is there's so many things that we do that we have access to nowadays that just make our lives more simple and easy. We're all very, very busy. Whether it's from a female perspective, microblading your eyebrows or doing your eyelash extensions. I wake up in the morning and if my eyelashes are done, I'm like, great, that's going to save me 10 minutes. Same thing with this treatment. Maybe it's not like a problem that's affecting you every single day, but it's one less step you have to take that just gets you on the road a little bit quicker. And then it just makes your life, the quality of life, better overall.
And can you catch up with people just in case they missed our previous episode? Like I said, shame on them for missing it, but they can still go back and correct that action. But what's the experience like if they come to the office? How long are they going to be there? Can they go right back to work? What is that kind of whole process like?
Yeah. So the treatment process for Brella is really simple, honestly. We do have to get patients sweating before they treat. So we get the room really nice and toasty. We have these really nice blankets and get you a little bit extra warm. And once we have induced that sweat, then that's when we go ahead and we dry the area, apply the patch. It stays on for a maximum of 3 minutes or until you reach a pain threshold of about a 7. Shouldn't be painful. Just once you start to feel uncomfortable, that's when we remove it. What's really interesting is when you remove the patch, it actually gets a little bit spicier and we start to rinse the area, wipe down the residue, and then that's it. I mean, it's super, super simple. No needles, no downtime. You can work out right afterwards. You can put deodorant on whenever you want to. Hopefully you won't need it. But very, very simple. And that's another point too, from a lot of patients who've come in, their main concern isn't necessarily excessive sweat, it's body odor, because those two go hand in hand. And so to be able to treat both of those concerns has been really neat, but super simple treatment, 3 minutes or less per side. Just got to get you sweating first and then you're on your way.
And the other thing that I don't think we've touched about is that you can actually, and probably I think the majority of the patients you and PHO treat actually do this in combination with other procedures. They're already in the office, they're numbing for maybe some RF, maybe some soft wave, some other treatments. They may actually be a little nervous of making them sweat won't be that hard. So you're making them used to their time. And so we have a lot of patients that love to just do this while they're already in the office, numbing, doing some other procedures, which again, all of us are super busy and you want to maximize that time and super easy to combine this. I don't really think there's a procedure you can't combine this with.
For sure. And that's what's been super cool and kind of funny is I have a lot of patients who want to do both. I'm like, oh, let's do our Brella first. I'm like, we're going to start with your lip injections because I know for a fact I'm going to get you nice and sweaty and then you'll be ready. So the ease of access, being able to combine it with treatments. And then again, it makes your overall quality of life so much better because you're not having to, it's one less step in your daily routine.
And PHO, the recovery from a treatment like this is what?
0. You're good to go. The only recovery that you have is you recover into having less sweat, like Jenna said, nearly immediately, somewhere between 3 to 5 days. No downtime. It's been awesome. There's really no preparation either. You can come on in as long as you have nice skin that is not necessarily, what's the word I'm looking for? No nicks or cuts. So we ask that you don't shave, of course. But it's been awesome. Really the only thing with Brella right now, and I took this from a patient, is we don't have a Brella bodysuit yet. So other
We're
than that,
working
it's
on it.
been
We're
great.
working
on it.
Yeah.
Maybe not a full bodysuit, but certainly
Yeah.
we want to be able to treat other areas in addition to the underarms because we know that there's some people who suffer in other areas as well. So we're working on it. We're working on
We
it.
can't wait.
And it's funny because when we first started talking about this, I was like, oh, we need to get this going right away because right now it's 105 degrees. Anyone who's been here in Texas knows that the summers have been a little bit brutal lately, but it's really something year round because most of us dress for the winter depending where it is. Last night we were at a dinner. I had a sports jacket. I had a sweater vest because I was trying to be cool with my first sweater vest ever, and then dress shirt underneath this, which was great for walking from my car to the restaurant stuff. But then inside the restaurant was 85 degrees, and I was stripping down layers by the end until the manager came and said you had to put something back on. So it's always was a little bit kind of eye-opening for me, and has been just as fruitful here in the winter, and honestly maybe more useful because I feel like in the summer sometimes people are like, oh yeah, you're sweating, but it's nice to be the one who's not. But something people don't even think about.
Absolutely. And that was something that I knew going into it, that was always been
Why didn't you tell me?
Well, I mean, you had to learn your own lesson. I knew that I always struggled with that. And so I would intentionally, and it's so hard because here in Texas, you could wake up and it's 42 degrees in the morning and then by noon it's 85. But you want to be able to wear those cute winter outfits and things like that. But then we always overdo it with the heater versus the summertime, you're sweating outside, you come in, it's nice and cool, you can regulate that way. But if you're having to be inside all day, they have the heater blasting. One of our PCCs, Amy, I work in her office and she always has her heater on. And now I don't have to worry about sweating my booty off because I have that Brella.
I mean, it's kind of such a flex to be like, when in the summer everybody else is sweating and you're like, oh, you guys are hot? Huh.
Right.
And it's just like, again, we talked about all empowering that confidence of being like, oh, you feel like, especially if you're in a business meeting, if you're in an interview, you're looking, for that perfect job. I mean, you already have a step up when the person interviews sweating and you're not. I mean, it's just such a cool, innovative, and you mentioned earlier, I mean, the beauty is truly in the simplicity, such a short amount of time, accessible to patients. There's not really very many patients, as long as your underarms are in good health shape, that aren't a candidate for this. And I know exploring a lot of other areas to do this is some of us have different areas that we perspire, and it can sometimes be a little nerve-wracking as well.
Mm-hmm. And I think one of my favorite things about this treatment that we talked about earlier was the overall confidence boost that my patients get. It's been interesting to see. I always ask my patient, what brought you in to treat? What is your trigger? What bothers you most about this? And it's been all across the board. Some patients are like, you know what? It's really just when I go to the gym, but that's when I feel my best. When I'm in there, I'm watching myself in the mirror and I'm getting my sweat on, but I don't want people to see my sweat. I just want them to have this, like, I want to have this really nice glow and get my pump on, but I don't want to be worrying about, okay, but I can't do these certain exercises because now my underarms are soaked. Or, I really have this beautiful silk dress that I want to wear, and it's really important to me that I'm able to wear it. Like, it's something that seems so small, but it's so impactful to them, and it really boosts the confidence.
PJ?
Yeah, I was just saying, it's really important, like you're saying, because if you don't post the selfie, did you really go to the gym? And who wants to post the sweaty selfie, And so it's perfect. I love it.
And Nikki, any last thoughts about Brella that you think our patients should know?
Well, first of all, again, thank you so much for making it so accessible to everyone in the Austin area and hopefully in the San Antonio area, because our goal really is to give that extra little boost of confidence, to make sure people don't have to worry about that sweat in the day-to-day life, whether it's the white shirt or the silk shirt, really giving one less thing to worry about. That's what we're all about, and that's what Brella was made for.
Jenna?
I mean, I'm super excited about this treatment. We have the little patches here. Can I show the patch?
Oh, absolutely.
Yeah. This is what the patch actually looks like. So simple. Honestly, very easy to apply, super accessible. Treat every 3 to 4 months, and I'm definitely due for my next treatment, so I'm going to be doing this very soon. But it has made a huge impact in my personal life, but also my patients, and it's just been really nice to see.
PHO?
I just love Brella. It's so easy for me to stand behind and to get excited about, like we're talking about with the mechanism of action, the simplicity. It just makes so much sense if you start to understand the sweat glands, and it gives my patients that boost of confidence. So I'm excited to see what Brella has to come.
Nikki, thank you so much for taking time out of your busy schedule. I know you're traveling coast to coast and made a pit stop in Austin to visit us. So I truly appreciate you giving up your weekend from your family to spend some time with us. So thank you so much.
It's been a pleasure. Thank you so much.
Don't forget to check us out, Plastic Surgery Untold, anywhere you get your favorite podcast. Again, if you want to see us, you can check us out on YouTube, actually see some of these patches, but download us anywhere you get your favorite podcast, iTunes, Spotify, Pandora. We'll see you guys soon. All right.